everyone. My name is Jesse Chason with Lisa Blanchard as the host of Airing Addiction.
I share often my journey started on this campus. Got sober as a client here, just like you.
I really do see phenomenal change.
Always hope. I've seen situations that on the surface look impossible become possible.
Doing this podcast is to share those recovery stories, be honest about what the challenges are and have some real conversations, but kind of share that out on the airwaves.
Hello, everybody. Welcome. Thank you for checking out Airing Addiction, however you're finding it on our YouTube page or on your favorite podcast, or if you're on live on Facebook. If you are live or listening to somewhat live, here we are, midsummer. Doesn't look like summer out there, but I'm confident we'll get some more summer days out there. And just to let you know, those of us that have been listening for a long time here, we have some great guests lined up. Certainly excited about today's conversation. And before we know it, we will be in Recovery Month in September, and we will be going live every week of Recovery Month. So just something to remember to put on your radar there. But I will turn it over to Lisa to introduce our fabulous guest for today.
Right. And if you don't want to miss anything when we get there, right, you can subscribe, do all of those things. We have zero ads. We get nothing out of this than sharing the messages that we want to. And that's part of what I'm really excited about for today. So, I always go to a lot of conferences. I present at a lot of conferences. And that's great. The content is great to hear what other people are doing and what is kind of cutting edge. But my favorite thing about going to conferences is the opportunity to meet people. And so this is how I met Jordan. We were on a panel together at a tech conference about youth substance use. And I've seen him at other conferences since. And I just am really excited to have the rest of the world in ways that, haven't heard your unique kind of way of really describing what gets in our way. What are the challenges in our system that make it difficult for individuals and families to access care, to get the support that they need? And so I thought you'd be a perfect podcast guest to talk just about that. So with that, we have Jordan Hansen with us today. And Jordan is a licensed alcohol and drug counselor. He's the CEO and co-founder of YourPath. He's an experienced leader, really delivering value to healthcare systems in integrated care, which I think is a thing that has had a bit of a hit lately in the kind of the current environment. The work that we've done to really try to have some value-based and integrated care has really been challenged as of late. Yeah. He's also been the vice president of strategy and growth for a recovery technology company. And before that, the clinical director of Hazelden Betty Ford's professional education solutions. And so I think more than ever, we need innovative solutions. We need to think differently about how we do things. And so I'm really excited to talk with you a bit today, Jordan. So Jordan, do you want to kick us off with just telling us a little bit about your journey to this work? Like how did you get here? What got you into this field? As much as you'd like to share.
Yeah, sure. Oh, I'm happy to be here. I won't go back too far, but I will go back. I am a person in long-term recovery, and what that journey looked like for me was, early substance use, 13 years old. Struggled for a long time and found my way into a relatively traditional recovery pathway initially. Went to outpatient treatment that the first time I think I was 17, and then kind of had a couple more treatments. But really what I found was I'm from Minnesota. I live in St. Paul, and I had no idea at the time, but St. Paul has a massive recovery community, and especially a younger recovery community. I just happened to, live there. And so the first sort of introduction I had to mutual aid groups was about as good as it gets. It was just like this huge community of people that I had no idea existed. It was like the secret society that I wandered my way into. But, prior to that, I had graduated with an undergrad degree in journalism, which was right when journalism was crashing into the mountain. And so I found myself sort of like trying to figure my life out. I always thought I was going to be a rock star, or I was going to, die of, substance use disorder or associated issues. So I kind of needed to figure something out. I got into this work professionally through two things. One is I did AmeriCorps when I was in early recovery. And so for people that aren't familiar with AmeriCorps, it was a national service organization. I did a year working with people with severe and persistent mental illness and disabilities, trying to find work. And what I saw was unrecognized or undiagnosed issues related to mental health and substance use disorder that were just so prevalent in the groups that I worked with. And I knew what was going on, because I'm like, oh, you're like sweaty and like what's going on? And they're like, well, I've been using Dilaudid and I stopped, just things that are normal to somebody with my experience weren't so normal. I guess in the context of the organization. The other thing that happened is this was around the time. So I've been in recovery for 18 years, and when I first got in, we were still in the stage of the crisis that was like lots of painkillers, and then like the first influx of like cheap and pure heroin into well, not the first, but an increase in overdoses. And so there were just so many deaths of people that I knew and loved. And I just remember thinking to myself, like what felt like a complete lack of urgency or compassion for the families and individuals. And so that got me all fired up, and I tried to do something about it, and ended up here somehow. And so it's been an interesting road, but I think at its core, the thing that drew me to this work is still the thing that keeps me in this work, which is just a real sort of like a two-sided, like it's both very, very, very positive and also very difficult, is this love and admiration for people seeking health and healing.
Everyone, my name's Jesse Jason with Lisa
also
Blanchard
just,
as the host of
in many
Airing
ways,
Addiction.
I share often.
I try
my
to keep
journey
it
started
from
on
getting
this
into the
campus,
rage category,
got
but just a
sober as a
real
client, just like
dissatisfaction
see
with the way that we approach
change.
things, and especially
Always.
around the lack of
I've seen
urgency
situations
and,
that on the surface look
just kind of complacency of like, yeah, we're doing
Doing this
great. I'm like,
podcast
no,
is to
we're
share those
really not. Like,
recovery
let's be honest. Like,
stories,
we're all, I mean,
be
it's
honest
a
about what the
dialectic sometimes that
challenges
we
are,
have
and
to
have
work
some
with
real
our folks on. It's
conversations.
like, we're
but kind
perfect
of
the way
share
we
that
are,
out
and also
the
we gotta change.
airwaves.
We gotta change now. Like, we gotta, and so I think that's really what I've been wrestling with for my whole career.
I love that. That dialectic that we work with individuals on is like, you are amazing just the way you are, and let's talk about what's getting in your way. And I think that's just such a great parallel process to what is happening in the state of, supporting individuals with substance use, right? Like, we're celebrating like significant reductions in overdose rate, and that's great, but we haven't made everybody healthy yet, right? Like, we haven't created a system that's easy to do, right? It's like we're saving more lives, and there's still so much work to do. So it's that balance of kind of both of those things at the same time. And the other thing that I think is really valuable and inherent in the work that we do at Spectrum is just the fact that you can bring both kind of this professional expertise and your lived experience. And when you're working with folks with SMI and disabilities and seeing, oh, I get this, like this, I recognize what's happening here. So much of that is, based and rooted in, the fact that you understand it yourself. And I think we have to just keep asking and involving and elevating the voices of those who understand to help us change our systems, instead of deciding from up here, which is really how addiction treatment started, right? Like this, we've talked about it on this podcast before, this paternalistic approach of like, here's what you have to do, and here's the path you have to take, and here's the one way out from this, do what I say kind of a model, to a much more organic, like, let's work together in that place that you describe of love and admiration for people. I'd love if you wouldn't mind just talking us through kind of what your work looks like now. Like, what is your path? Like,
Yeah.
and how does it work?
Yeah. So we started YourPath at the height of COVID. It was myself and two co-founders, all people in long-term recovery. I'm the sort of baby of the group with, 15 years in this field. And we'd all had I think, a similar commitment to attempting to affect change at a systems level through different services. And so the two co-founders, Jeff Larson and Phil Jura, one worked as a clinician and yeah, I mean, I guess they're both clinicians, a medical provider, so a nurse practitioner, and then also an addiction counselor. And we wanted to, at the time, we set out to provide immediate access to people that were looking for medications for opioid use disorder, and then also comprehensive assessments, which in Minnesota is sort of the administrative pathway to getting into treatment. And so those were the two bottlenecks that we wanted to address first. They weren't the only services or the only bottlenecks, but at the time, what we were seeing is a lot of people were being displaced from programming, and they're essentially just sort of, everyone was really struggling to be useful in the way that our community needed us. And so with changing needs and the community related to COVID and some of the restrictions around like communal living and things like that, we just decided to get started. And so what that looked like for us was we had a friend who had a barn, and I joke like it's a really nice barn. Like it had Wi-Fi, but we started the company in a barn, and we started seeing people initiating MOUD via telehealth, and then just trying to hang with folks who historically, people, I would hear things like, well, they're not ready. And immediately I'd always be like, ready for what? Like everyone's ready for something. Like, well, they're not ready for what you think maybe they should be ready for, or what you think they need. I'm not really sure what that means. And so we had this inkling that if we were able to engage with people and try to be useful to them, that they keep coming back to us. And so that was really the genesis of the company. Over the years, it sort of grew and changed. We ended up building out a technology platform because none of the technologies that we were able to use off the shelf really suited our work. Technology is built for administrators and for payers. That's not built for clients. Like no one's asking prospective patients like what would be helpful to them. And so every time we have somebody register for like a patient portal, and then we're like surprised that they don't show up because are we cussing here? Well, I'm going to try not to do that. Okay. I mean, they're pieces of shit. Like, let's be honest. Like the things that are built aren't like everything else in our life is convenient. And then we're like, hey, healthcare is like faxes. And so we just ask people to tolerate things that we would never ask for in any other sort of consumer experience. And so what we were trying to do is like, how do we make it as easy as possible for people to find help? How do we make it as easy to find person-centered recovery supports as it is to find drugs? And it's super easy to find drugs. Like you could airlift me to anywhere in the US and give me half hour and I bet I could pick up. And then we're like, well, they don't want it. They're not ready. And I'm like, oh my gosh. Like, and I think this is part of, the experience that I hope, we're able to continually hear, because sometimes as a program administrator, it becomes really easy to tune that out. And it's not that we're perfect, like we screw up all the time, but that commitment to listening and trying to figure out like, what's hard about this? Why is it that, 80% of residential programs continue to not use evidence-based medications for any sort of substance use disorder? Like, why do emergency departments discharge people to the street instead of, like, if I went into any emergency department, if Jesse or I went into any emergency department with chest pain, and you too, Lisa, but really, for white men, like they $80,000 workup done. And for somebody that's experiencing an overdose, there's no consistency. There's no adherence to evidence-based guidelines. Why is it that I just read this morning, a young woman in northern Minnesota died in the Benton County Jail from alcoholic ketoacidosis. Why is the criminal legal system the largest provider of behavioral health services in the United States? Like, these are the questions that they're not very fun to talk about. And this is, it's kind of funny, Lisa, you talking about the conferences. I think what Lisa is referring to is me asking these questions, I think, publicly and trying to stimulate some of this conversation, because I think the conversations we have on panels are very different than the conversations that often happen in the hallways and in our real lives. And I'm just kind of over it, I think. So I'm happy that you invited me on, either because of or regardless of that. I'm not sure which.
Well, Jordan, I'm certainly hearing a lot of really great points you bring up there, and just to reflect, I shouldn't be amazed at this point, but as someone in lived experience, like, your story sticks out as the right time, the right place, the right situation, the right people, and you were like, screw it, we don't care if it's a barn, it has Wi-Fi, let's go, right? And we just, it's very evident from hearing you today that you just want to help people, regardless of what that looks like. We need to help people, right? And certainly to reflect on that statement there, that hopefully everyone knows listening to this, but maybe some people just spit out their coffee or something when you said that corrections are the largest provider of behavioral health treatment. Like, what? Right, with all these online platforms and telehealth, and I could go on today and get a therapist in a different state, and like, all this stuff, and it's like, how come there's so much, like you said, bottleneck to access to treatment? And I was laughing internally because I just sent a fax just yesterday to another provider, and it's always that like sinking feeling of, oh, did they get the fax? Oh, I got to call and make sure they got the fax. But yet I can walk in any store with my Apple Watch and pay for whatever I want, or FaceTime somebody, or there's all this other technology, right? So I think your program, YourPath, is a phenomenal program. I was on your website earlier, and sort of reading up about it, and just love to hear more for our, for my own selfish reasons, and for the people that are listening, about what that morphed into. You started in a barn. You started with these comprehensive assessments that are part of the treatment modality out there where you are located, in providing medications, and what's that turned into today?
Yeah. So the hope is, I mean, it's not as in vogue as it was when I started my career, but the idea of recovery-oriented systems of care has really been a driver for me, and it helped me attach some like a scaffolding of thinking on like, what are we doing? Like, what are we working on? Really, the goal for us is to try to benefit the entirety of the system. And what I mean by that is, most organizations, because of the financial pressures and limitations that we're under, we are really intensely focused on the internal workings of our program, because we have to be. We have to make payroll. We have to, make sure that our accreditation stays up to date and our licensure is okay. I mean, knowing a little bit about Spectrum, I mean, I'm assuming that's a huge part of your job, is making sure that the OTP regs are followed on a regular basis and the mountain of paperwork every year is done. So when I say this, it's not to attack anyone or be trying to speak poorly. It's just that we are overwhelmed with our own internal needs, and what it makes it really, really difficult for us to take a step back and to even have time to take a breath and look at the entirety of the journey that people have through these systems. And what I mean by that is, I kind of alluded to this earlier. 80% of people with a substance use disorder diagnosis in the United States get no care at all. Zero, none. They never make their way to a place like YourPath or a place like Spectrum. And they're suffering. And like by definition, the diagnosis requires impairment. And so we have to ask ourselves, like, where are they? Like, what's going on in their lives that we have these folks that, like, what's happening? And I think if we look at our experience and the research, they're at work, they're in our correctional systems, they're in our child protection systems, they're suffering, in somewhat visible ways, but somewhat invisible ways. And this is really what we're trying to work on is how do we make the invisible visible? How do we help people understand what's happening within themselves? Because lots of times the nature of the illness is such that they don't have a lot of insight into like what's happening or what the problems are or what the solutions might be. And then our goal is how do we as a air quotes point solution work within the system that we have, maybe not the one that we want, but the one that we have currently, to have an outsized impact. And so really we're trying to focus on these points of entry into the system. So emergency departments, EMS services, deflection and diversion programs. We're part of a statewide program in Kentucky trying to deflect and divert people from the criminal legal system entirely if they don't need to be. And so I think it's a little bit of a different approach in some ways because, yes, we're a point solution. We see patients. That's really not what we're after, though. What I would love to do is not need to do any of this. And so is there any reason that everywhere shouldn't have walk-in availability for medications for opioid use disorder? Every primary care clinic should be able to do that. It's not honestly, it's less complicated than 90% of the stuff that they do already. And so I think this is really our vision is through a technology platform that tries to make the clinical or recovery experience similar to what you just talked about, Jesse. It's like I can transfer every dollar that I have with 2 clicks of a button, and yet for me to like get my records, my PHI, like I could put it on a billboard if I wanted to. This is where people don't understand about HIPAA is like why we can't share that information. I personally can. I can do whatever I want with my medical information. And so that's really what we're trying to do is make it easier that when people reach out for help, it's not just one program, because that's the other thing is that what we see is these really backwards incentives. So like everyone does care coordination if it means that they're going to get patients into their program. But then you have really horrible mismatches with clinical presentation and I could go on and on. I don't know. I'm ranting now, but I promised myself that I would try to keep the ranting to a minimum. But
that is part of why I invited you here. So don't worry.
Rant away, Jordan.
A couple of things jump out at me in that part of it is, that recovery-oriented system of care. And it is kind of, people aren't talking about it anymore. It was like, the flavor of the month almost for a while. I mean, we've done a lot of work in this space. We still train on the recovery-oriented system of care because we still think it matters, right? Because yes, you're right. Like we have, over 250 treatment beds, and we are about to open several more, right? And we, have, several licensed OTPs. Like we have episodic care, but we can provide that episodic care in a different way. And so really approaching that, system of care long term, like, okay, maybe somebody right now does need one of those, and like, let's make that easier, right? So what we do walk-in OTP services, we're trying to get to 7 day a week, or at least 5 day a week, but we have every site has a day. So like you could admit to any one of ours and start that telehealth for methadone. We do the same for buprenorphine with like a hub and spoke telehealth model. We have a mobile unit for OTP, like driving around the city of Worcester. Like we do correctional treatment. We are the medication provider across the state prison system and in many houses of correction. So we're doing both at the same time, like trying to reduce those barriers in the treatment system. But we also have to look at that system of care and how can we be part of that long-term solution, right? So we have, 5 peer recovery support centers across the state. We're adding recovery coaching in more places and more roles that can support somebody differently than directly tied to their treatment, that kind of one-on-one lived experience. And we've tried to do lots of things with case management. And unfortunately, in Massachusetts, we had a 5-year pilot with an extension of a couple of years. And with all of the financial changes happening and the sustainability of that on the Medicaid side, they had to cut somewhere. And guess where they cut? They cut the community partner care coordination program that had those long-term goals of, reducing ED, like starting that integrated care individual person-centered medical, psychiatric, substance use, like all of those social determinants all together, one care plan for that person that had really great data, right? But the problem with it is that great data doesn't equal a financial change in the short term. It equals one in the long term. And so when things get cut, they get cut because right now it's not saving, respectfully, payers, ACOs, right? Like it's not saving the system right now, right? Like there's less incentive, and you probably heard me talk a little bit about that at the last panel we both attended. Like it's short-sighted, and it's the first thing to get cut.
It's always the first thing to get cut. I mean, and this is, I think, the conversation that I don't want to have. I feel uncomfortable all the time because I feel I want it to be productive, and at times I get so frustrated that I feel like I'm maybe not as productive. But I also I wish we would maybe have a little bit more of a candid conversation. Payers, if they wanted to do true value-based care, we would have been doing this the whole time. And I think the things that I hear behind closed doors, or I've been privileged enough to be at some of these tables. I'll never forget. This is probably 10 years ago now. I was on this work group, and we met in some fancy lobbyist office in DC off of K Street, and they had the heads of all the MCO, like the Medicaid MCO, so all the big ones. And at the time, the CEO of Centene said, if you can't have an ROI sub 18 months, we're not going to do it. And I'm like, cool, we're done. Like that is a fatal, that kills most of the true value that we're able to recognize. And their point was, if someone's going to churn provider coverage within, if the average length of coverage on their Medicaid MCO managed care plan is under 18 months, they need to see ROI under 18 months because they're not going to invest in someone else's care if they go to a different provider.
Right. And then the other provider benefits from that.
Well, and then if we take that dynamic and we multiply it not just by payers, but by providers as well, because as you said, like if your organization can't make case management work, we can't do it. So then, so this is where it gets really easy, and I'm including myself in this. I love to throw shade at the people that actually have money, because they're the ones that actually have money. They could do something differently, and they don't. And also, we're all sort of beholden to this same sort of dynamic. Is that I need to make payroll at YourPath. Like that's not negotiable. I'm not able to ask someone to come in and volunteer their. I mean, I could, I suppose, but like it's not fair. We deserve to get paid for this work. But it's that dynamic across the state of our system that I think is just, it leads to these like farcical discussions where we're like, well, what are you doing around value-based care? And they're like, we're rearranging deck chairs, and we have been for 15 years. And if we want to have different outcomes, we should probably do something differently, and this is like, it just, all right. I can feel my like blood pressure increasing, right? Because it's like we work so hard day in, day out to really make a difference. Let's at least just be honest with the limitations that we're up against. We're up against a system that revolves around short-term return, period. End of story.
And our community partner program ends, June 30. So I'm in this same kind of nervous system dysregulation space as you are, because one of the notes that I kind of made to myself was that we really show our societal priorities with where we put our time and our like that.
Yeah, budgets. This is one of the. I mean, we've really had a lot of pretty significant pain in Minnesota. For a while now, but especially over the past few weeks. Budgets are moral documents. Like at the end of the day, from a political standpoint, is you get to put your money where your mouth is. If we as a country say that we want to, and I'm just going to use specific, we have Health and Human Services saying that they want to start the Great American Recovery Initiative. Cool. I'm completely down for the Great American Recovery Initiative, but if we're doing that at the same time that we are absolutely decimating the infrastructure that supports recovery for millions of Americans, it's very difficult to take those claims seriously. In Minnesota, we recently had a few thousand Medicaid providers disenrolled and unable to bill Medicaid because of what amounted to administrative errors. And yes, we made mistakes. Like I personally, we as YourPath forgot to include some people on there, but does that mean that we need to be completely disenrolled? Like it's a pretty stark contrast between our stated commitments to our priorities, exactly like you said, and what we're actually doing. And I think the first, just like we're working with our clients, I mean, the first part, like let's just have a discussion on like, what do you want? And if we as a country don't want to do, like if we want to lock people up and let people die, and I mean that is a choice. But if we say that we don't want to do that, let's at least have an honest conversation on the outcomes of the policies that we're advocating for.
Yeah. And like you said a little while ago, Jordan, I wrote down so many notes here, but how do we make the invisible visible, right? If we don't talk about it, if it should be, seen and not heard, if it only comes up in the context of, crime rates or overdose rates, or, you can make some data look like, oh, it's getting better, but it's still those are people represented, right?
Yeah.
And my own lived experience started with the correction system, and it could have very well continued with the correction system the way I was going, and but for the grace of God, there was a case manager there that asked me that magic question: "Do you want help?" And she was that flimsy reed of hope that got me into Spectrum, when I did.
Yeah.
And through some minor miracle, she's still employed at that same correction center today. And
Yeah.
she's on the Christmas card list because I'm forever grateful for her reaching out and jumping through all those hoops to get me to where I needed to go. Right. But, I say that just to say that I hear every day my experience is not, other people's experiences are different. Someone reached out just this week, cold called me practically and said, "Hey, I got someone coming out of jail in 6 months. What do I do?" So that automatically tells me like no one's talking to that person. They're just going to be released one day, and like you figure it out on your own. And like, yeah, I know a couple people in different various systems of care. We can probably hook them up with something, but to have that be the flimsy reed of a lifeline, like a just a Hail Mary text message, like, "Hey, can you help?" I mean, something's going on here. I think we can be doing a better job.
Yeah. I mean, that's, I guess, to dig a little deeper into why I do this and why I started this. Yes, I'm a person in recovery, but my recovery experience, it's never irrelevant. I think everyone's experience, whatever they bring to this work, whether it's they describe themselves as a recovery or not, doesn't matter. We all bring ourselves fully to we hopefully bring ourselves fully
Yeah.
to this work. But the thing that has really become maybe more immediate or more important to me recently is my closest friend died of an overdose in 2019. We got into recovery together, and we ended up going to grad school together. Like he was my my first like real friend in recovery. Like I hung around all sorts of people that I normally like wouldn't hang around with because it looked good and I wanted to try it out. But he had started using again here and there, like while we were in school and afterwards, and he would call me periodically and say there'd be a crisis. And but this last time he called me, and he'd been up for a few days and going through withdrawal from opioids. And I was like, yeah, man, like we got you, like whatever you want to do, like I'll come pick you up, what I mean? Like I'll do whatever. And at that point I'd been in, recovery for 8-10 years, something like that. Was really tied into the local recovery community. I was like, you guys talked about in the intro, like I was clinical director at arguably like the most prominent treatment organization maybe in the world, I guess. If anybody should know how to navigate this, it theoretically would have been me. And what I found myself up against was the same situation that hundreds of thousands, if not millions of Americans find themselves in, is that we are faced with a maze. So on one side, we have real incredible urgency and dysregulation and really high emotional and fear and just, I love this guy so much. I would do anything for this dude. Like I would literally do anything. And then I got the maze in front of me, and I feel like I got about 5 minutes to figure out what the options are. And at the time, he didn't have any money, he didn't have any insurance coverage, and he wanted to go to a non-clinical 12-step immersion program. Same program that I helped my brother get into. It saved my brother's life. The presentation was very different, though. So for him, somebody that has a long history of opioid use disorder and trauma and mental illness, I was really concerned about this because I knew that they don't believe in medications. It's not a clinical program. And he ended up going there, and he had internalized a lot of the stigma that I think people have around medications for opioid use disorder. It's not actually recovery. This isn't what we're doing. He gets out, they made recommendation to go to sober living. And he's like, no, man, I'm too old for this shit. I'm not going to go live with a bunch of 20 somethings in a house. Get out of here. And, we know the end of that story. And so we were cleaning out his apartment, and it was, myself and my wife, and we couldn't find somebody to watch the kids. So my kids are coming. And they're like, I think 3, 5. So they knew Tom. Right. Like but they didn't, and they knew he had died, but they couldn't grasp exactly what was going on. But we're looking through all of his stuff, and I find the letters that the kids wrote to him while he was in this program. And I find, it's a life, like, and so I remember thinking to myself, like, gosh, is this the best we can do? Like, really? And it wasn't. There's always the questions of if I had done, whatever. I think that's normal. It's human. But I think that really for me is the urgency there, is that we had everything at our disposal and we failed. And it's not failure in the sense of, we need to continue to like turn over it but just truly, I'm glad that we've seen a reduction in overdoses, fatal overdoses, but really, it's hard for me to become too excited about those data when that doesn't mean anything, truly. Like to the father who I was talking about earlier, whose daughter died in the jail, like that doesn't mean anything to somebody who lost somebody last week. It's just not good enough. And that doesn't mean that we'd burn ourselves out or feel like we need to carry the weight of the world, but it does, I believe, require us to have an openness to try new things. And I think that's really what I try to cultivate, and we try to cultivate. What would it look like to just attempt to find a little bit of time and be like, what would it look like for Tom to get effective help? And so that's really what drives me, is things like that, stories like that. It's like hearing from people. Just like you said, Jesse, I've been open about my recovery, and prior to starting YourPath, I get, I don't know, anywhere from 2 to 5 calls a month. Somebody's cousin's mechanic's brother, needs some help, and we don't know what the hell to do. And I don't know who to call. And I heard that you might know something, and trying to be useful and after hours. But it's like, why is it like this like secret thing, and you got to be in the club to like know what's going on, and you'd be like, and then you find somebody who knows like the arcane, like dark arts of like navigated insurance systems, and you're like, wow, you're like a wizard. This is amazing. Like, why is it like that? Like, I don't know.
And it just shouldn't be. So, first, I just, want to express, how sorry I am for the loss of your friend. Yeah. That's not what we want to be driving us. And
right.
I think it's a really powerful example of how our society and system is not treating this in the way that they need to, right? So if Tom had cancer, there would not have been this, even perception that, you know what, I think you can just do these support groups over here. And listen, like Jesse and I talk about this all the time. We talk about this on this podcast. I'm a firm believer in lots of support, and 12-step has supported 1 million people, and it's great. And you want to make sure that people feel comfortable and not judged or stigmatized, and have the evidence for what would be most helpful then, and that the paths would open and clear for people to access what they need in that moment. And that's what happens often when somebody does get like a cancer diagnosis. You know, you don't have to know, the top of the hospital to get in. You know, like I say the same thing, like I get lots and lots of calls because people know what I do. I put it out very publicly, but you shouldn't have to call the chief clinical officer of a large nonprofit to get your needs met, right? Like you shouldn't have to go that high. Like it should just be available, and everybody should have the information. And that stigma is real, and that internalized stigma. Thank you for naming it, because that has so much, like our stigma and our systems create that internalized stigma for those that would maybe have benefited from some evidence-based care, but because that stigma still exists so much in our recovery community. And I think we have to say that more out loud.
Yeah, I feel like we've seen, I don't know what it's like where you all are sort of living and working. There's been a lot of progress, just a tremendous amount of progress. And we're also seeing like the pendulum swing. It's just back and forth, and it's so disorienting because now we're seeing places that feel or appear to feel, they don't always say it explicitly, is there is a real a hit that was taken to the credibility of peers, the credibility of professional or paraprofessional, even non-professional recovery communities and mutual aid. We're seeing a lot of what I believe are real, like just mis and disinformation regarding like 12-step recovery in general. And like, so when people hear me tell this story, oftentimes, like, I agree with you, like, yes, like, it's wild that, we have a medication that, I mean, if we could reduce death in any other disease state by 70% with a medication, that it would be in the water.
All-cause death rate, right?
Yeah, it would be, in vending machines, like and yet, we continue to fight that stigma and misinformation. That's gotten a lot quieter. It's been sidelined. People, I mean, I got called a scourge on the recovery community. Like I remember back in the old days, like it was not pretty. And I also, just to be open and transparent, I had those same biases as somebody who like came up in that world, and like,
you don't know what you don't know.
Yeah. And so I have a lot of, or at least I think I have a lot of compassion and patience for people that have their own experience, regardless of what that is. And then working through that as they maybe get into the field as a professional. And that those sorts of biases, they take any shape or flavor. It's not just 12-step. It's really interesting to watch the pendulum now swing. And I'm like, oh, dang. All right. Like, that's actually not what those groups are. Like, just so you know, but it's wild.
Lisa talks about it all the time. I reference on air often that unless you're intimately involved yourself or others, the treatment world, it's this black box that nobody really knows. And, I was laughing when you said the dark arts, and you're a wizard if you know how to like put together insurance care and admissions and all this stuff to just get somebody that very clearly needs the help, the help that they very clearly need. Right. So, I mean, I'm blown away at what you do. Again, I echo Lisa's sentiments. I'm so sorry for your loss with your friend Tom. It really shouldn't be the my own personal opinion. It shouldn't be the motivator to get into this to help prevent that. Right. I much rather like it be, to help people in general. But the stark reality is, I have a whole drawer in my office at home, a desk drawer of funeral cards, and I'll take them out and I'll leaf through them from time to time and just reminisce. and think about what like you said, Monday morning quarterback, what could be different? What can we learn? What, imagine if this person did something and maybe they're still be with us. Who knows? Right. But all I can focus is on the here and now. What can I do today? And I guess if there's a question there at all, is where, I mean, I could talk to you for hours, but I'm sure we should probably wrap up soon. What's keeping you motivated today? What's the hope? What are you goals you're looking forward to accomplishing, or what's the future look like according to how you see it?
Yeah. We're in a moment of, I think we're in a sea, in the midst of, or like right on the front end of a sea change moment, um, where the conversations that are happening on the ground are way ahead of the conversations that are happening in places like the conferences that we talk about. The conferences are way behind. I think the things that are commonly talked about in polite company are old, they're tired. The things that are exciting are happening in the real world, and it's among people that don't necessarily fit or operate within the current structure or schema of sort of the power structures that are existing right now. I think the current power structure is on its last legs. I think we've seen the failure of what I would call like a bifurcated treatment approach, where we have specialty treatment and then we have healthcare. I think um, we're seeing just more and more that the thing that actually works is community and is recovery, and that's always been true. I love the work that we do. It sounds like you love the work that you do at Spectrum. It's important. We went to school for a long time. We think we're helpful. Also, recovery doesn't happen here. Like, what I don't want for somebody is for them to be like with us forever, and like this is where their recovery lives. And I think this is what makes me excited. Is, yeah, it's motivating to have some of these things, but really that's not for me what motivates me. What motivates me is, I got to see somebody yesterday who I knew when they were really struggling, and they're here because of naloxone. But also naloxone is not, it's like doctors don't get into medicine to do CPR, right? Like, yes, they will do it, but like, what's amazing is getting to see people that have a life now that they could have never dreamed of. And I include myself in this. I have a job that I like mostly enjoy. I have people that I love to work with. I have a family that I never thought that was going to be part of my story. I'm able to do all the things that I thought I couldn't do anymore in recovery. I get to go to shows. I get to play music. I can do whatever I want. And I think this is where I'm starting to see this arrangement of power shift, that we have medical doctors that actually care about this work, which like even 10 years ago was like not happening at the scale that it is now. We get to talk to fellows and residents and medical students. They love this stuff, and they like go to school for this. It used to be like people like, ASAM was like all the doctors that had issues and got into recovery, and then there's like all 12 of them would get together, and like we're seeing a sea change in the medical world that's coinciding with peer support being way ahead of the curve as it relates to truly person-centered care, but not person-centered in the way of like, oh, just do whatever you want, man, it's all cool, but like person-centered and like, what do you want? We're going to go get it. Ready? Like this is your plan, but like I'm here for you, and I'm kind of cool being like a little bit annoying every once in a while. Like, not like mean. I just care about you. I love you, and this is what you said you want to do. Let's roll. Um, and I think that's what gives me hope and excitement, is a universal dissatisfaction with the way that healthcare is run in this country, a almost universal dissatisfaction with the institutions that are holding power and holding the cards, and also little glimmers and embers of sparks of really promising approaches. That's what has me fired up these days. Is like it's I don't know, and then I'm like, is this a reform or is this a revolution? I'm not really sure. And I think it's both. But like whatever it is, I'm super excited about it, and I think I don't know. I think about sometimes like how frustrated I get, and I look back and I'm like, man, we've made a lot of progress in the past 10 years. This is pretty cool. I hope 10 years from now, we look back and I think of like what I said to you guys in this podcast. I'm like, well, that's pretty outdated and that's pretty lame. Like, I hope we make that much progress. And that's why I think having like honest conversations is good. It's cool for us to be outdated and fine, like whatever. Let's just keep trying.
And be open to be outdated. Like I want to be outdated. Like I want to
Great.
learn new things. Like I want
Totally.
that both and, right? Like
Wouldn't
I
that be
want
wonderful?
that dialectic there. And I appreciate that, my executive director of peer support, Athena Haddon, who we've had on, always does a great job of describing kind of that peer role and perspective as like support, but also truth tellers. And I think that is such a great, you were such a great example of a truth teller. And I also, one of the things you said is like recovery doesn't happen in treatment programs, right? Like that's not where it happens. And we have to be like, accept that and be okay with that. Like what we do is we save lives. We start people on the path to healing. We give them access to evidence-based care. Like we make things possible, but when we opened our 5th peer recovery support center in Southbridge, Massachusetts, that what I said at that opening is true. This is where recovery happens. Right.
Yeah.
In that space. And so I think that is a wonderful way.
Yeah, and it doesn't take anything away from what we do. Like that's the part that I always get like weird about. I'm like, what do we do? Why are we fighting? Like I love it. That's great.
Because we need that foundation, we need that scaffolding there. I literally, as you were just saying that, Jordan, a few minutes ago, I had to pinch myself because it still doesn't seem real that I share those same sentiments that you shared about, I have a job that I love. I went to school for a long time to be able to do this. Like I have a life today that, I say that too. I can do whatever I want, provided that I have that solid foundation. And thankfully at the right time in the right place when I needed it, Spectrum was there to give me that solid foundation so I could go out and do my recovery and live a full, meaningful, satisfied life. And at the same time, YourPath in Minnesota and Kentucky and Spectrum in Massachusetts and hundreds of places all over the country and the world, that's the foundation starter, right? Without that, it's the launching pad, right?
Yeah.
So it's very important what we do for sure. And I just wanted to thank you so much for sharing your very evident passion and heart with us today. I will take away from this conversation yet another fellow soldier, arm by arm with us, fighting the good fight, and sharing and doing this work to really reach the people that otherwise would not be reached with a solution and a hope. So thank you, Jordan.
Yeah, we're trying. Oh, thank you for having me.
Thanks, Jordan. As expected, this conversation did not disappoint. It was really an important one to have. And I hope that everybody has enjoyed this. Feel free to check us out again. We'll come back in the summer months with one in July and one in August. And then, as Jesse said, lots more in Recovery Month, which is our opportunity to celebrate where we have come and where we are. So thanks, everybody, for joining us. It's been great. Thank you, Jordan. Really appreciate it.
Yeah, thanks for having me.
Bye.
Bye, everybody.